So beautiful to see you again. And now we are in the last month of the year 2022. How amazing, how grateful I believe you are. Myself, I'm so grateful to God that He's been faithful and, seeing the last month of the year. And if you're watching Girl Vibes today, I mean, you need to be grateful. We are about to vibe today on a special topic. And before that, we'll go for a break. When we come back, I get to introduce my guest to you. My name, as always, is Mercy B, the Akufi Princess. And today, one guest that I've really missed so much is back. So let's go for a break. When we come back, we get to vibe. Welcome back. And I told you I have a special guest that I've missed so much. One beautiful lady that I've missed so much. And let me introduce you to Mary. Yes, I've really missed Mary so much. She is a clinical quality advisor. One of the reasons why I love her so much. In fact, I don't know whether we can be friends, but she's a special guest. And anytime that she comes on Girl Vibes, I don't know why. Mary.
Fans now don't so.
In fact, Marfil, honestly, it's been like two to 3 years.
Absolutely.
Close to 3 years.
Yeah.
When we started Girl Vibes, we started with you. And
know.
that's one of the reasons why I can never forget you, you know that.
Right.
Never ever. I won't ever
I take all
forget
the fans. It's good to be
Hey,
back.
And you're looking much younger now.
Thank
With
you.
a braid, is it dreads?
Yeah, dreads. I have
Wow,
dreads.
it's so beautiful.
I have a little bit of extension.
Oh, okay.
Let me just put that disclaimer there.
But it's beautiful.
Thank
And in
you.
the black,
Thank
But
you.
first of all, before we even get to the topic itself, being in the month of December, in the year 2022, I mean, how do you feel? The last month is here, and you're here too.
Right. It's a lot of mixed feelings. I mean, looking at how our economy is going, Charlie, it's good to be alive, but
Yeah, but still, bring your nose in Kokono. Yeah, boy.
I have to come to your house.
Please come. You're welcome anytime.
Right.
And I have with me a beautiful lady with a beautiful name. Hey, as in what one did? Evan Chanamengumun Massachusetts, elbows in the mouth.
Evangeline.
Okay, that's a beautiful name. Maybe I'm more first of all know your bar. But the better. She's a student from the University of Ghana, and we are going to talk about understanding abortion and its consequences. And that's why we have a clinical quality advisor. And I know when it comes to the young ladies, we need more advice when it comes to abortion and the family talk. And having a student, we are going to vibe today. First of all, I want us to know. Let me start with Mary. Mary, since you are a clinical advisor, when we talk about abortion, I know we've done abortion before, but this is a different side of it. But I want you to repeat to remind people when we say abortion, what is it?
All right. So I think I'll just give you the clinical definition for
That's
abortion
fine.
because there's legal definition also.
Okay.
In short and in plain language, it's just when the product of conception or a fetus comes out before age of viability.
Okay.
So say a woman is pregnant and then the fetus comes out either intentionally or unintentionally before it is able to survive. That's what we call an abortion. In Ghana, age of viability is at 28 weeks, so say like 7 months. And I'm saying in Ghana because in other countries, fetuses can come out at 14 weeks, 16 weeks, 20 weeks, and they can survive because they have all the systems, the equipment to take care of it. It is not so here. So for our context, any pregnancy, if you're pregnant, then the contents come out before 28 weeks, we term it as abortion.
As abortion. Okay. Now let me come to my beautiful student. We want to know as a student, why do you think some females decide to do abortion?
Okay. So, most of the females decide to do abortion for so many different reasons.
Okay.
Some people, or in school like this, some people want to focus on their academics, on their career. They have plans. They made their plans. This is what I want to do in 5 to 10 years to come.
Okay.
A baby is not part of my plans. A baby is coming to disrupt my plans, what I have and all that. So somebody wouldn't want to bring in and want to nurture a baby. No.
Okay.
Yeah. And then other people do not have the finances.
Okay.
Yes. Some people, when the baby come in, they are okay. They want to, okay, there's a baby. I don't want to abort it. You never know the plans God has for the baby.
Okay.
So in this case, and then there's no good financial background, the lady would think twice about it, and then she would go like, no, I do not have a good financial background to bring the child up, so I would have to terminate the child.
Okay, so those are some reasons. Now, let me come to Mary as a clinical advisor. What are some of the reasons you hear people, people do make as reasons for going through abortion?
Right. So first of all, you ask your question in the direction of students.
Yes.
Usually, we think that the typical abortion seeker is a young lady, a student who is not married. But you'll be surprised to know that the typical abortion seeker is any woman who is in a reproductive age between 15 to 49 years. So there are married women in there, there are career women in there who seek abortion for various reasons, in addition, including what she mentioned. Sometimes one of the things that I like talking about, because a lot of people don't talk about it, are policies and protocols. That's one reason why women will terminate their pregnancy. Let me give you a typical example in our security services. When you pass out or you are commissioned for the first year, you are not allowed to get pregnant. That's one side. The second side is, they go on missions, how do they call it? Peacekeeping missions. If you are pregnant, you can't go, and they make money from there. The other thing is, when it's time for promotions, they undergo, I think, physical training. And if you are pregnant, you are not allowed to do that. And so that means your promotion passes you by. You can imagine how painful it is to see your colleagues that are supposed to be on the same rank with you, you are saluting them just because you got pregnant. So these are some of the reasons, some of these systems and protocols. There are other issues of, when she mentioned the issue about money and being in school, it causes a lot of distress. Emotionally, women are not mentally healthy when they are faced with situations like this. And so based on that, even when you don't have money, it causes a lot of emotion and stress. Look at the way I was complaining about me, but you see, so emotional distress, you not being mentally sound are some of the reasons why women will terminate their pregnancies. Of course, there are the very obvious ones like sexual offenses, rape, incest, defilement. You can just imagine you've been raped, you're going to have a child, you see this child, and always this child will remind you of that horrible experience that you went through. So I'd rather terminate that pregnancy than give birth to this child who will always remind me of all these unpleasant situations. So these are just but a few of them. Of course, there's the clinical side also. So when pregnancies will cause risks to either the physical or the mental health of the woman, she's allowed to terminate the pregnancy. So physical risks, such as there are some women, when they get pregnant, they suffer some medical conditions. Either the condition starts or it aggravates. One of them is what we call pregnancy-induced hypertension. So you don't have hypertension, but just because you got pregnant, you develop hypertension. If it is not if it's not controlled and managed, you can even lose your life out of it. It comes with a lot of complications. And so you're allowed to terminate your pregnancy if something like that happens. Also, then there are situations where you take a scan and then you realize that there's something wrong with the baby. Some parts are missing, the baby is abnormal. People don't want to have a child and then it becomes a burden on them. Something that's supposed to give you joy then becomes a burden on you. So then women also terminate those pregnancies.
What about the men? Did they, in terms of pressuring the women to abort, do you hear such instances too? Are they also reasons? And should that even be a reason for you to, let's say, should a pressure from your man be a reason for you to abort a pregnancy?
Right. So let me be a bit political here. You see, our abortion law of Ghana gives conditions under which you can terminate a pregnancy. And one of them is what I mentioned, a risk to either your physical or mental health. So if you have a partner who is worrying you, giving you pressure, and you think it's affecting your mental health, legally you are allowed to terminate that pregnancy. However, it should be a choice. The fact that your partner says, go and terminate this baby, doesn't necessarily mean you have to do it if you want to keep it. So even with all these reasons and legal requirements, at the end of the day, it should be a choice of the woman.
Right. So you shouldn't allow your man to pressure you.
Pressure you. If you want to keep it, that pressure shouldn't. And if you can take care of the baby and you want it, the partner's, how do you call it, pressure shouldn't get to you. In fact, when you want to terminate a pregnancy, it's only the woman's consent that is required. So if the man says go and terminate and the woman says no, I don't want to terminate, she's the one who is going to give consent. So it's basically the woman's choice.
Now let's come to the risks that are involved in abortion, let me come to Evangelica. Evan, let me call you that way. Evan, so can you tell us some of the risk in, going through the process of abortion?
Okay. So as she said earlier, sometimes there's a problem with the baby or the growing of the baby inside the womb. So when the abortion procedure is being done, sometimes in taking the baby out or the fetus out, what happens is that there's the scarring of the uterus because probably the lady's body is not fully matured. So there's the scarring of the uterus. And sometimes when the instruments used by the doctor are not sterilized well enough, the woman can have infection of her fallopian tubes.
Now that brings me to this question. Mary, what is involved in abortion?
Right. So before I answer that, let me quickly just add on
That's
to
fine.
what she mentioned
That's
about
fine.
the risk. So you see, abortion can be safe or unsafe. If you have a safe abortion, risks are very minimal
And
to
at
none.
what point is it safe?
Safe, right. So I'll come to that.
Okay.
So for all the risks that she mentioned, if you have an unsafe abortion, then you are exposed to all these risks.
Okay.
For an abortion to be safe, one, it should be done by a trained provider. This trained provider should use WHO recommended methods. And then whatever method the person is using should be appropriate to the age of the pregnancy.
Okay.
Now, for abortion to be unsafe, or now WHO is saying we have less safe and least safe.
Okay.
So for less safe abortion, all these things that I've mentioned, one of them is missing. And for least safe abortion, all these things are missing. So the abortion was not provided by a qualified person. They are using dangerous methods to do it. And that is when all these risks that she mentioned comes in. But if you have a safe abortion, if you go to a good place done by a registered, a trained provider in a registered facility, and you have a safe abortion, risks are very, very, very minimal.
Okay.
Right.
And that's all. And what about those that go to the counter to buy, you go to the pharmacies to buy some drugs that are prescribed by friends, and is that one too safe? And how well will you even know the drug that you're taking?
Yes, that's a very good question. So for instance, if you take abortion, you basically have two methods, either medical abortion or surgical abortion. So medical abortion is where your drug issue comes
Sure.
in. If you think you want to have a termination, you want to use drug, you can still go to an abortion provider who will give you a drug. So you don't necessarily have to go to a pharmacist or a pharmacy shop to buy just any drug at all. You don't know what you are buying, you don't know its efficacy, you don't know how it's been stored, you don't know if it's even recommended by our FDA. So it's good even if you want to use a drug to terminate your pregnancy. Go to a provider, a trained provider, a registered facility. They still have the option to give you the drug, either there or they can prescribe it for you to go and buy. But it's not advisable to go and buy your own medication that is prescribed by friends.
Okay. Okay, that's fine. So on that note, let me remind you that we are live on Facebook as well at ETV Ghana. So any comments, though I can't read it right now, make sure you leave it there. Next week, I'll ask Mary, I'll call her through the phone and get to know all the comments, questions from the comment side. And then I'll ask her and I'll personally tell you. So we are live on Facebook. Make sure you share. Today's topic is very, very important to every female. If you have a sister, in fact, even your mother, and your own wives, your girlfriends, any female in your life, make sure you share this so it will get to reach to them. We are talking about understanding abortion and its consequences today. And I have with me beautiful Mary that I've missed so much. She is a clinical advisor, and I also have a student from the University of Ghana. So let me go to my Evan. Evan, let me ask you this. Now, I posted some of the artworks on my pages, and people were asking about, actually, let me not even say it was a question, like we're putting it to facts there. Urban ages, that go through abortion, the career women, and when I was from the ages of 20 corner. In fact, was a teenagers in the crack home. Now, quite today, paying for the mumpo where you want to see Jennifer. So, Ivan, I want to know, you being a young girl, will you also put it as a fact there, what they are saying is the truth? Mary, I'll ask you as well, because you know it more. But I want to throw to the students first. So, Beja today, here students na and more, and I didn't pay in the phone also count as in the current state, you won't work on a hand.
Okay, so with this current state, the LD are also passed, they also do have the abortion. But then it's the students actually do have the abortion more. The highest point in abortion at this time is between the ages of 20 to 24. So if you take
Oh, okay.
1,000 women, you have 25 of them committing abortion. That is between the ages of 20 to 24. See, most of the time they are in school, planning their careers and all. And
Okay.
some probably after their diploma or after senior high school and do not continue with university, have work going on for them. So they don't want a baby coming in to mess up their plans.
Oh, okay. Okay. So it means that what your page news it was right.
Yes.
Okay. Let's also ask Mary, being a clinical advisor.
Yes, I mean, she's right. If you look at data from our clinics,
Okay.
most of our abortion seekers are between the ages of
20s.
20 to 30. So we are still within that range. And I think she rightly said at that time, they're at the height of their career. They're also highly sexually active around that time, exploring,
Exploring everywhere.
and all that. So yeah, and then they are, like I said earlier on, they're also in their reproductive age.
Okay. So is it that we the young girls in that range are just having fun more, or we are just having unprotected sex? And at that age, is it safe to even have abortion?
Right. Okay. I think that age is very common because of all the reasons that
Okay.
that we give. I mean,
Okay.
that's the reproductive age. So
Okay.
a lot of women fall into that age. A lot of them are having sex around that age. When you talk about safety, there is no. Age has got nothing to do with it.
Okay.
Okay. So if you remember the definition I gave for a safe abortion, it should be done by a trained person. You should use WHO recommended methods appropriate to the gestation, and it's safe. So whether you are young, whether you are old, age doesn't really matter. Once you are going to the right place, it's been done by a trained person and they are using the right methods for you. It's
Okay.
safe to have an abortion. We've gone past the time where people thought that abortion is, you know, in the movies, they depict abortion to
scissors,
and so a lot of us grew up thinking that that is
Yeah.
it. But abortion is a very simple and safe procedure. In fact, research has shown that having a termination in the first trimester, that's within the first 3 months,
Okay.
is actually safe than carrying a pregnancy to term and giving birth. That is, if you go to the right place I'm talking about.
Okay.
It's simple. It's a simple process. It takes between 5 to 10 minutes to have an abortion, a safe abortion.
Okay.
So it is that-
So those stories that we hear, I think misinformation is that if and you na call abortion, na call doctor hopa, like that kind of thing, because SMP, but now that kind of, we hear all those misinformations. I don't know whether you've heard some that you want to share with us.
Baby, a lot of misinformation, lots of myths, a lot of misconceptions, just to scare women and girls out of doing
Okay.
it. But like I said, years ago, abortion we're using a lot of unsafe
Yeah.
methods to
People
do
were
it. So it
using
came with a lot of
herbs and,
complications. But it has evolved. Some of the methods that were used years ago, even WHO is saying that you don't use them now because they weren't safe. And now we have a lot of safe methods and safe procedures. And so abortion is very safe once you go to the right place and it's been done by a trained person using the right methods,
Okay.
like I said.
Okay, Evan. Now I want to hear from you. What are some of the misinformations you hear about abortions?
Okay.
Interesting ones.
As you said, you could die.
Yeah.
So, people actually do die from abortion, but then that is when it comes to the unsafe abortion.
Yes.
When you go to a
Just as Mary
professional,
stated.
like she said, you can actually survive,
Okay.
and then without the infection, like
Okay.
I earlier said, and we can go through it safely. But then people actually also tend to believe that they are going to have this heavy bleeding in the end. It sometimes happens though, but then you'd have to go to the right person. If you
Okay.
go to the right place with the right professional, you won't have to go through these other things like the heavy bleeding
Okay.
and then all that. Yeah.
Yes, welcome back. This is Girl Vibes, and we are vibing on a very interesting and very important topic today on ETV Ghana. Intimate Patrol, any female in your life, no one say ETV CCS and Patrol. Ma on funny TV no on fan to not catching the year vibe. Now, Mary, before the break, we were talking about the misinformations, the myth, and all that. Now, do we have any barrier to abortion?
Yes, so one of the barriers is the misinformation, the myths, and
Okay.
all the miscommunication. I mentioned earlier on that you know, you watch movies and abortion is depicted as bibi mama. And so people watch these things and then they feel like, hey, that is really not so. It's a very simple procedure. Like I said, 5 to 10 minutes.
Is it very scary?
It
Like
is
the
not
way
it is not scary.
Okay.
It is not scary at all. Mercy, in fact, you'll be surprised to know that now you can even sit in the comfort of your home.
You don't mean it.
Pick a phone, call
To a doctor?
call a doctor, call Mary Stoops, call a contact center and say, hey, I have this and this and this, like I've gone through this and I want a termination. You'll be counseled on phone, you'll be
Okay.
consulted on phone.
That's good.
If you want a medical abortion, it can be delivered to your home.
And it's safe
Simple as that.
for you
that
to
is how
go through
simple
because you have
abortion.
the doctor on phone, directing you, counseling you,
Absolutely.
and all that.
Absolutely. So I mean, this all the horrendous picture we've painted about abortion, they are all false. Like I said, even when you walk into a clinic and you want to have a surgical abortion, between 5 to 10 minutes, you are done. You get up, you walk home, and go and continue your life like nothing has happened.
Wow.
Yeah. So these are some of the barriers: the miscommunication, the misinformation, and you know, like I said, things parents say just to scare girls not to do it. People will tell you that, oh, if you have an abortion, you will never give birth again in your life. It is not true.
Yes.
You can have.
I
once you
was
have a
coming
safe
to that
procedure-
question, but let me jump up to
Right.
Yvonne and then I'll come to you. It looks like I'm asking you all the questions. I don't want to do that. Please don't do that to me. Yvonne, I want to know, do this misinformations or myths scare we the young ladies from doing the abortion?
Yeah. So you see, in Ghana,
And does it stop them?
yes, in Ghana in general, as a society, we don't agree to abortion
Okay.
because they feel like if people are well informed about abortion and then it's and all about it, they would actually abuse it or make it a norm. But then for me, that is not so. You can actually inform them and then they'll go through it the right way. So some of the barriers include the lack of accessibilities to these hospitals. I mean, in the rural areas, for instance, you
Yes.
won't get an abortion clinic over there that I am going there, or you can't call somebody who is close that I want to have an abortion or something. No. So because of that and then the lack of the services, people would resort to having the unsafe abortions, and then it can lead to them dying or other health complications.
Okay.
And then also the stigmatization. People are scared. They're like, okay, if I come, even if I go to the hospital, well, even in the hospitals, not all, but some of the nurses, they go like, sometimes they say it and, you know, they give you the eye. But some people actually like approach them and then they go like, weren't you brought up in a Christian home? Didn't your parents teach you well? I mean, how come you got into this? Don't you know better? So even with the fear of all that, they wouldn't want to even go to the clinic at
And they
all.
won't even open up to people who can give them the right advice.
Exactly.
Like Mary, for instance.
Yes, exactly. And then even with the procedure, sometimes, let's say if the doctors are not available for the procedure, some of the nurses who are capable of doing that stand in for them. And then some of them feel like, no, this one should know better. And then, so as a form of punishment, you know, they actually sedate the patients or the women so that they don't have to feel the pain. Some actually don't fully sedate them, so they feel parts of the pain, and then they're like, yes, that is a lesson for them. Next time you won't even want to come and go
and
through
do
this
it
again.
again.
Yes, so they actually make the process, which is not supposed to be a painful one, a painful one for them.
Intentionally.
Yes, some do it intentionally.
Mary.
Right.
Wow.
Yes. So these are all about staff attitude, like she said, which more or less is ingrained in our social upbringing, not clinical. Because in as much as people have been trained to provide clinical service, we all come from different backgrounds, religious, cultural, and so you know I'm a doctor, I'm a midwife, I'm supposed to provide the service. But because you have moral objections towards abortion, it's an ended dear. You try to discourage people from doing it, and one of them is, like she said, you know, all this bad attitude that some providers, not all, will exhibit towards women and girls seeking abortion care. So there are few isolated cases like that. I would, however, be quick to say that Ghana Health Service is doing a beautiful job of overcoming some of these things. So currently, Ghana Health Service is looking at institutionalizing comprehensive abortion care in all their regular services. They are
Wow.
training their staff. So there's good news. And then they're also combating some of this staff attitude by doing what we call values clarification for the staff who provide abortion care.
Honestly, sometimes when I see this young mother struggling and begging for people to take care of them because they have kids that, you know, for better words, I don't know, but I just want to put it there, kids that were not planned for, you just give birth to them because you feel you were pregnant, and so per your religion or whatever you want to give the baby. But, you know, don't also forget about the future of the kid, because I believe the start of a child, you know, leads the person to who he or she will become. So if the government is helping in this way, I think it's the right way to go. So I feel excited. But now let's talk about the family planning advice, where family planning equally comes in when it comes to abortion. The advice on it. But let me throw it to Yvonne before I even come to you. Now, as students, talking about the advice on family planning and abortion as well. Now, at what point do you think the family planning will be necessary, you know, in takeover abortion?
Okay, so the vital role of the family planning is that they help you plan your pregnancy so that you don't have any unwanted pregnancy. But then in such cases, when you do get pregnant, they come in and then they help you. So these family planning services actually give you the advice on what to do, help you. So if you want to still go through the abortion, they give you the right procedures, the right services, they direct you to the right professionals so that you go through it safely.
Okay.
Yes.
Now, Mary, let me ask you, as a female, do you have the number of times to have abortion? Are there restricted times, or you
I
can
laugh.
do it any?
I have to laugh first because it's also one of the
It's a
misconceptions.
first question that she want me to ask you, because she was like, Messi Pacho said, a clinical advisor, but say, hey, I'm sending mom there. You know, can we go through it for 3 times? And as some say, we can only end at the one and only one, and then it's fine. So I want to ask you,
Right.
it's a number of times, or if you go through the first abortion, it's fine for you to plan for your life and move on.
Right. So I'll come back to having a safe abortion.
Okay.
Okay. If you have a safe abortion, you can get pregnant again. And then, so if you have a safe abortion as many times, you can get pregnant as many times.
Okay.
However, it's not advisable. Okay. Because then we are manipulating your uterus. There's a misconception that if you have abortion for a number of times, it's going to get a time when you're pregnant, it will automatically abort because your uterus is used to that. Those are not true. However, if you have an unsafe abortion and then you have complications, some of the complications can lead to infertility where you cannot get pregnant again. So once again, the emphasis is safe, have it safely. However, remember I mentioned Ghana Health Service earlier on.
Of course.
They actually have standards and protocols for providing safe abortion in Ghana, okay, for providing comprehensive abortion. And one of the objectives of that protocol is to counsel every woman who undergoes abortion on family planning and provide the family planning option to them immediately after the abortion. And so, you know, you are not ready to get pregnant. It's safe to have a family planning method immediately after the abortion so that you are protected and then you don't have to have a repeat abortion again.
Okay.
Now, anytime you are ready to get pregnant and then have a baby, then you can stop your family planning. So, whilst there is no recommended number of times that you can have an abortion, it is advisable that even when you do the first one, take a contraceptive method and protect yourself.
Okay.
So you don't have to do a repeated one.
Okay. Okay. But what if it just happens? I mean, there are times it can happen, you know, without you even taking your pills within the month or putting any emergency pill in your bag, and you tend to have fun. I remember I was having a discussion with a friend, and she had to have fun to the extent that she even forgot to, you know, take in her emergency pills for like over 3 days, and later she was like, okay, Messi, you know, I'm in this mess.
Right. So actually, it does happen. It does. So it's not that it does happen all the time. If you look at women who have induced abortion, most of them fall into that category. Okay. And that's why we recommend that anytime you have an abortion, in fact, it is mandatory for anybody who provides abortion services to counsel the woman on contraception and provide the service. So it's always good to, do that. It is, in fact, it is required of every service provider to do that. I just want to do a bit of clarification. I'm not saying
That's
it is
fine.
mandatory to give somebody a contraceptive. It is mandatory to counsel
Counsel the
them
person.
and let them choose a
So
contraceptive.
they have the
and provide.
decision to
The
go
decision
in
is
for
yes, but
any.
for providers of abortion service, you have a duty of care to
Okay.
counsel that person. If that person comes to you 10 times, you must counsel her on contraception and family planning 10 times.
Okay.
Anytime you have a client seeking abortion care, you need to counsel
remind
them
them of it.
on family planning and contraception, and actually provide it. If you can't provide it, refer them to where they can take it, so we don't have repeated cases of
And when you
abortion.
cancel and they still don't want to have it.
You
But
can't
do you know?
force people.
Do you know? Even up until now, some people have some misconceptions about contraceptives, and so they tend not to use them. But rather, when pregnancy comes, and then they tend to shiver or feel it's a mess, and they get themselves into it. So what do you do in these instances that the person does not want to take the contraceptives?
Well, it's for you, the provider. Your duty is to counsel the person. You
Okay.
can't force the person. It's a clinical service. The person has to accept and actually consent to it. So you can't give them something that they are not consenting to. Your duty is to still counsel.
Okay.
Like I said, don't give up on the person if they come to you 20 times.
Of course.
Counsel them 20 times. Maybe one day the message
They'll
will
fall
go
for
down
it.
and then they will take it. But then it's also not good to turn away the person just because they are refusing to take a contraceptive method.
Okay.
Because you don't know where they are going to end up. They are safer coming to you for a number of times than going to the quack a number of times, because you give them a safe place. The quack might
And if
end
they
up losing
don't
their
get you,
life.
they will turn out to the other side.
Absolutely.
Because they really need it at some time. Okay. Now, Evan, why is it that some people are scared of taking in the contraceptive, since it's the safe way, but they still feel they're scared of taking it?
Okay, so it's because of all these myths and then misconceptions. Some people feel like if they take the contraceptives, when they want to get pregnant in the future, they wouldn't be able to get pregnant.
Okay.
And then some people also feel like the contraceptives actually do not make them enjoy the sexual intercourse. So
Okay. So
So-
they won't go for it.
yeah, so they won't go for it. They
Okay.
rather feel like some feel like I would time myself. I mean, I know my ovulation period, so
Okay.
I'm going to time myself. And then even though you would know some people actually do study the ovulation period. Even though you would know it definitely, that sometimes it changes and you will never know when it changes. So when it does, that's when they find themselves in the unwanted pregnancies.
Mary, let me ask you this question before we even time, starts clicking. I saw this video on social media that was trending of a lady talking about how scared she is to, of getting pregnant during, having an intercourse during menstruation time to get pregnant. And so getting pregnant, let me put it that way. So she was advising people that the safe period to have sex is your menstrual period, because at that point there's no way the eggs will work or whatever, so there's no way you can get pregnant. And so I decided to fetch knowledge, and I asked a different person, and the person was like, no, if you're menstruating, there are times the blood will rather store the whatever for a long time. But you being a clinical advisor, I want to know from you, and a health person, I really, really want to know, does the sperm work at the time that the lady is menstruating? Can the woman get pregnant during that period?
Okay. So first of all, sperm can stay up to 3 to 5 days in a woman's body. Okay. So you might think you are safe at the time you are having sex.
Okay. That is
But then
during
maybe
your
3
menstruation?
It could be during your menstruation or not. I'll tackle the menstruation
Okay,
bit earlier, but I want people to understand something. That sperm can stay in your body
Okay.
for 3 to 5 days. So you might have sex at a time that you think you are safe. Some 2 or 3 days later, you are not safe. That sperm that was deposited there some 3 days
3 days ago.
can
Still
make you
working.
pregnant when okay, so this issue about and that is why using your the calendar method, your
Oh,
fertility
my
can
producer says
fail.
repeat that one for her, please. It's very important. Yeah.
So
do
sperm,
take one.
sperm can stay in a woman's
Repeat
body.
it again. In fact, increase the volume.
Sperm can stay in a woman's body for 3 days
Interesting.
and not die off. And so you can have sex at a time that you think you are safe. Some few days down the line, when you ovulate,
3
that
days.
sperm can make you pregnant. And that's one of the reasons why
Okay.
using the
The
ovulation
period,
does not work
yeah.
a lot. You need to study your body very well. That's one side that I need people to understand. The part about when you have sex during your menses, you will not get pregnant. It's not entirely true. Because for us women, we all have different cycles.
Okay.
And these cycles have number of days in which they work. It ranges between 21 to 32 days. So somebody who has the 28-day cycle, they are the ones that, you know, during their period, you know that they are safe and all that. So it's okay. But if you have a short cycle, you could be, and it's rare, but it can happen. You could be ovulating during the time that you are menstruating, maybe towards the end. And so you never know. And remember I said the sperm can stay there for 3 days.
Menstruating?
Yes. So there
We
are
are
some
really learning today.
right. And remember I said the sperm can stay there for a
3
number
good years.
for a number of
Days.
days. So your best bet is to use contraception. I'm not saying using the calendar method is wrong. It's not wrong, but the failure rate is quite high.
And what about the pull-out?
Especially if
Yeah.
okay.
Because most
That's
of the men feel safe with
that's
that.
another one that also fails a lot. And also because of this, and I hope listeners should listen to
They
this
should
part
listen
very
very
well.
well.
Sometimes before the man pulls out, something has already been deposited there
Hey, Mary, what are you
before
saying?
it comes.
What
Oh
are you
yes.
saying?
So if you know during sex,
Okay.
during the excitement, you know there's some fluid that comes out of the the man's
The man.
penis. Okay. Some call it the pre-ejaculant or seminal fluid.
Okay.
It's very plain.
Yeah.
Sometimes it can contain active sperms. My ladies out there,
Hey.
hear and listen this. And listen to this.
Hold
Sometimes
on,
it
Mary,
can contain
pause,
active
pause
sperms.
and continue and repeat it. Please, have you clicked on the button to share on Facebook? Hurry up and do that. It's at ETV Ghana because we are really learning today. Did you know that a sperm of a man can stay in you for 3 days? Most of us didn't know. So, Mary and Pacho, it's hobby, mom.
Right. So that fluid, that plain fluid that comes out sometimes contains active sperms.
Okay.
And so even before the man ejaculates, he will come out. So already some active sperms have already gone. They've started the journey. That. So you say, that's why you know women will come back and say I'm pregnant, and the man says it's not me
No,
because I
I
pulled out.
get
Because
it.
some of these things happen.
I
The
get
other
it.
thing is that it takes a lot of self-control to pull out. A lot of self-control. So you might get there and there and you're possible. Or by the time, like I said, by the time you pull out,
It's gone
akra
already.
drop it. And you don't need a lot of sperm to get pregnant. So you need one single one. Just one tiny drop contains so many millions of sperms.
Then
Yeah.
it's gone.
It's people use it. It's my work, but it feels a lot also.
Wow.
Your best bet is to use a contraception, a contraceptive method.
The
Right.
pull-ups. Okay. Mami sham na means men come when I mean if pull up side now it was just, you know, but it's needed. We have to know all that and we are learning today. Now let's come back to our main topic, which is the abortion, because the pull-ups ning are not a pregnancy no zebra. It's normal commandum education and people being scared of the contraceptive pills and all that. Now let me come back to the abortion that I was asking. After going through abortion, what are the safe ways, or is there any food, or you know, is there any exercise that we can do to help to get ourselves, develop ourselves, you know, in a good or a healthy way?
So the answer is a big no.
Okay.
It's a big no. If you have a safe abortion, you are good to go. Like you came in, you don't need any special food, you don't need any special medication. If you go to a safe place that has a safe procedure for you, you don't even need antibiotics after the procedure.
Okay.
This is WHO recommended.
Okay.
A good place will give you what we call prophylactic antibiotics. Let me not be too clinical here.
Okay.
So you get a small dose of antibiotics to help prevent infection. But after the procedure, you don't need any antibiotic. If the procedure was done in a sterile manner, you don't even need antibiotics. If you did not bleed, you don't need any blood tonic. All you need to do is just go about your normal duties. You might feel some few cramps, especially if you do the surgical procedure, so you'll be given some painkillers for about 24 to 48 hours. And that is all. You don't need to eat anything. You don't need to do anything special. Just go
Evan,
about
did
your
you
normal
know
activities.
this? Do you know?
Here and there, not entirely.
Okay. So which one do you know?
Okay, so I'm aware that with the abortion, after the procedure, you are given the painkillers. But
Exactly.
they're not fully aware that it's just up to 24 to 48 hours. Yes, because some misconceptions are people tend to think it takes more days, like
Exactly.
up to, let's say, 2 weeks to 3 weeks to even a month, because people believe that when you have the procedure, you're not supposed to do any tedious or heavy work after that. You can't go about your normal job. You're supposed to rest, be at one
And that
place.
when we come, we'll go for a break. When we come, I'll ask Mary all that because we need to know the duration of the abortion, the number of days and all that.
Yeah, and also depending on the week in which you had the abortion. I mean, as she said earlier, it's safer to have it within the first trimester. That's the first 12 weeks, not later. Even though you can have it later.
Okay.
Yes. So even with that, the procedure, yes, people think that with that you'd have to kind of suffer the bleeding she talked about. People think that yes, after abortion there's necessary bleeding, I'm supposed to see something coming out, but then the abortion actually does take care of the bleeding. It comes out and then you are set in the hospital like she said. But then people feel like after the procedure, when I go, I'm supposed to see something, and that's like part of the misconception.
Interesting. Okay, on that note, I'll take a breather. When we come back, I have a lot of questions for Mary. Stick, we'll be back. Yes, so thanks to Adonko Next Level Premium Energy Drink. That is the one and only energy drink that me, Mercy B, I recommend to you. Anytime I juma bre, I hear was in Biampacho, making sure they bottle Adonko Next Level Premium Energy Drink. You'll be at as there was supermarkets in Nepadeto. Do so need to net on from 020 489 8698 or 059 261 0898. Adonko Next Level Premium Energy Drink, no limit. So today we are talking about abortions, you know, the misconceptions about it, the consequences, everything about abortion today. We are talking about it, and I have with me a clinical advisor. Yes, my one and only sweet, beautiful friend, that Ma Fenodoro. She's back today, and she's teaching us a lot today. And also, I have Ivan, a student from University of Ghana. Yeah, you know. Evan, what do you really study as a student, your course?
Okay, so I'm studying biological sciences as a course.
Oh,
Yes.
okay.
But then I'm majoring
I think that's why. Okay, I get it now. That's why you know more about this thing. Now, let me ask you this question again. I want to know. Now, the misconceptions and the misinformations that we made mention about it. And then I went back to Mary asking her about, you know, people really listening to it. And then you were talking, but I had to break you and then we went in for the break. So sorry for that one. Now, I also want to know from you, do people really scare away from this myth that acquire abortion are Igbo?
Yes, yes.
I want to ask that question
Yes.
again.
People, some people feel like if I go in for an abortion, I'll die. Because, I mean, I've heard that if your body is not too matured enough to go through the abortion procedure, you may die. And I don't know for myself. I don't want to go and seek advice. I don't want to open up to anyone because of the fear of stigmatization or anything like that. So, yes, people feel like they'll die. But then the process actually takes, as she said earlier, 5 to 10 minutes. And then after the 5 to 10 minutes, if it was a safe abortion, you can actually go home. If there's any discomfort or cramping, you can, the doctor actually prescribes antibiotics for you, and then you take home and then you are good to go, just like she said earlier. But then some people feel like after the abortion, I'm supposed to see a chunk of blood coming out, but then that is not so, because that is the main aim of the abortion procedure. So during the abortion, the blood is actually taken out. So before the baby forms in the womb, I mean, it forms from a clot of blood. So that is what is taken out, and that is what is known as the fetus. That is what is taken out. But people still think that after the process, I'm supposed to see, but no, that is not it. The abortion procedure, the safe abortion procedure, takes care of that. Because some people, when they go through the unsafe abortions, they actually go home and then do see this chunk of blood later, like falling out. That is when like they actually spread these rumors or myths. Yes, but then with this one, it is because it was an unsafe abortion, unsafe abortion. Yes. So when you have an unsafe abortion and then you have this blood flow out, you'd have to go out and go back to the hospital. But then you'd have to go to a professional so that you go through the right procedure, because probably the first one didn't take care of everything, and then the right procedure from a very good professional will do the right thing for you.
Okay, all right. So, Mary, how long does a safe abortion take?
All right. So I mentioned earlier that we basically have two types of abortion.
Yes.
Medical and surgical. For each of them, the duration is different. Okay. So if you take a medical abortion where you take a drug, okay, currently, the drugs that have been approved by FDA, some of them imported by Mary Stopes. Okay. There's one which is a combination. Okay. A combination of two drugs. Okay. So you take one drug instantly. After 24 to 48 hours, you take a second drug. So it's a process. So you take one drug instantly.
They'll take you through all that
yes.
process.
So you take one drug instantly. 24 hours of between 24 to 48 hours later, you take the second drug. Okay. And then you start bleeding. Now, for medical abortion, the duration of bleeding is unpredictable. It can be any time between 3 days to 3 weeks. Okay. However, as the days progress, the quantity of bleeding should be coming down. Okay. However, between how do you call it, the first 2 to 3 days, whatever is inside there should come out. Okay. And then whatever bleeding comes out is just minimal bleeding that can go
like
on
the normal menstrual flow.
Like normal menstrual. Okay. Normal menstrual flow, or even less than that.
Okay.
However, like I said, if you go to a safe place, you'll be told what quantity of bleeding to look out for. So typically, any bleeding that is will pose a danger is when you soak your pad. You soak 2 of it in 1 hour consecutively for 2 hours. That is dangerous. That is too much bleeding. And so any trained provider will tell you that if you see something like that, immediately come back. Okay. Most of the time, it means there's something still left in your womb that must come out. Okay. So that's one of the complications of abortion. That's the people who don't know or those who don't do it won't tell you. And so, like she said, people will go home and go and bleed, and they're happy. Oh, I didn't You are in danger. So any bleed, if you soak a pad, 2 of them within 1 hour consecutively for 2 hours, that is dangerous. That's too much bleeding.
You need to go back to
You need to go back. So if you go to a safe place, these are some of the warning signs they will tell you that look out for this. Otherwise, any bleeding that does not conform to what I described, it's okay to have it. Okay. So for, like I said, for the medical procedure, the duration is quite unpredictable. You can have everything coming out within 2 days. It's be a week. But then for the surgical, okay, like I said, 5 to 10 minutes, it's done. The provider will actually look at whatever has been taken out to check if everything is complete. And that is it. When you go home, you're not expected to have any significant bleeding. Okay. Same thing, if you are bleeding more than necessary, which is what I described to you, it's dangerous, it means come back. And you will be given this specific information. We go as far as even putting it down on a take-home paper or sheet, so that when you go and you've forgotten what we said, you can even refer it and know what to do. And the other thing is that for any good, safe abortion service provider, you need to give a 24-hour contact number to the client. Okay. So now when she goes home and she's experiencing some of these things, she can call you. Some of them, because of the whole scary thing, even the bleeding there, and cry, and but because of all the horrendous things she said, they are scared, they want to talk to you. So you should always be available to talk to them and then allay their fears through.
Mary, our time is almost up, but before I let you go, let me ask you this question. Some ladies, in some funny ways, okay, have this feeling there's sperms here, baby mahwan, and to their body. Some even say to the skin and all that. Is it true? Does the sperm do anything to the body or to the female, with the exception of giving us kids?
Wow. That's why you have to ask a dermatologist. This is outside my scope of speciality. Okay.
Anyway, maybe when we get a skin person, we get to talk about all those funny things. But I don't know. I don't know. But we hear. We do. I know you've heard it too. Now, Evan, we are going. Is there any advice you give to the young ladies or the female out there watching us today?
Yes. Okay. So for me, I'm a Christian. So I would say you should totally abstain, because if you are able to abstain, there's no, there's no chance, or you have a better shot of not going to the abortion clinic to have an abortion. And then with that, you are able to take control and then plan your future in 5 to 10 years. This is what I want to do. This is where I want to be in life. I want to be this, I want to be that. Like, you get to plan and then take total control of what you want to do. But then for those who can't really abstain, I'd advise that they do make use of the contraceptives. They are in the pharmacies and on the market. It's better to use the contraceptives than the other things and people imagine. It's better. Yeah.
Okay, so thank you for coming. Now, Mary, wrap it up, or in a snap way for us.
All right. So I think right from the beginning, I keep saying that abortion is not as scary as we've made it seem. Yes, over the years when we were using dangerous method, it was scary.
Exactly.
But things have evolved. Things are better now. They are not as scary as we think. So if you must have an abortion, please go to the right place, speak to the right people. I'll put out numbers that you can call, even just to talk to somebody who can give you advice.
That's fine.
So for my dear ladies out there, it's not as gloomy as you think, okay? There are safe options. Go to the right place, talk to the right person. You can have a safe abortion and then be safe out there. Like she said, use contraception.
Okay, so what I will add up is that you own your life, you control your life. So make sure in planning your life, think about your future kids, plan it well, and live a happy life forever. In fact, if there's anything like ever after, live a good life and plan it well. My name is Mercy B, the Akunfi Princess. Thank you for watching. Thanks to my crew, my producer Rashida, one and only. We are in December, and to this year's Christmas, you busy as a boy in Coco. Don't worry at all. And my director Johnny John, that jollof you promised me last year, I'm still waiting. We are in Christmas again, December. So remember, on Girl Vibes, we are going to celebrate the Christmas through everything you need to know about Christmas and what to do for Christmas. We are going to talk to the extent that even when we are entering this year, we will set up your resolutions with you right here. So make sure every day you catch up with Girl Vibes on ETV Ghana. Thank you for watching. Have a good night. And thanks to Peter, my cameraman. Hey, Peter. But Mary, the numbers, so you almost forgot them.
Right. So you can call Mary Stoops toll free on 0800 208585. Toll free to all networks. 0800 208585. You can also send us a WhatsApp message on 0244 208585. You can follow us on all social media handles at Mary Stoops Ghana. We're on Facebook, we're on Twitter, we're on Instagram.
Hey, I like the way you said it.
Yeah. I'm profiling myself small.
On that note, thanks to my son, Manjasti. This year, we'll celebrate the Christmas together. We need to have a party. Have a good night. Enjoy your day as well. And stick watching ETV Ghana. Thank you. I'm out.